Next, we'll take a moment to understand the inguinal canal and the features that you see to your left: the inguinal ligament, the superficial inguinal ring, lateral crus, medial crus, and intercrural fibers are all demonstrable on this particular illustration. The inguinal ligament is the inferiormost aspect of the aponeurosis of the external abdominal oblique, and we see that inferior margin running along here. It attaches laterally and superiorly to the anterior superior iliac spine, and then its medial inferior attachment would be to the pubic tubercle. In this medial location, along this region, we see an opening within the aponeurosis. This happens to be the superficial inguinal ring, and on the medial side of that, we have a medial crus, and on the lateral side, we have a lateral crus, and then we have these interdigitating fibers interconnecting those two crua, and those are the intercrural fibers. In a man, the major structure that we see here traveling out through the superficial inguinal ring is the spermatic cord. The spermatic cord enters this region by passing internally through a deep inguinal ring, and as it travels through the inguinal canal, it will pick up all the layers that we see eventually emerging through the superficial inguinal ring. When we think about the inguinal canal will present two walls. It'll also have a roof, and it'll also have a floor. So what we want to do now is to explore the components that form the anterior wall, the posterior wall, the roof, as well as the floor. Using the same image as the previous slide, our focus here is on the anterior wall, and the anterior wall has been reflected, so we are looking into the inguinal canal itself. So let's take a quick look at some of the landmarks here. This is your deep inguinal ring, and you see some vascular structures passing through the deep inguinal ring. This muscular structure that we see here in a man is the ductus deferens. So it passes through the deep inguinal ring and is now traveling within the inguinal canal. And then it passes through the superficial inguinal ring at this particular location. The anterior wall has been reflected. Contributing structure to the anterior wall is the aponeurosis of the external abdominal oblique, which we see in through here. And there's also going to be a lateral reinforcement from the internal abdominal oblique muscle. So right in through here, and this would be the lateralmost aspect of your canal. It too is being reflected away from the canal. The posterior wall is that area that we see in this general vicinity. The fascial component that we see that would pass behind the spermatic cord contents that we see at this level is the fascia of the transversus abdominis. This is referred to simply and aptly as the transversalis fascia. More medially here along the posterior wall and not visible at this particular point in time is a tendon referred to as the conjoint tendon. It is formed by the aponeuroses of the internal abdominal oblique as well as the transversus abdominis. So that helps to reinforce the medial third or so of the posterior wall. The roof of the canal has been opened up, so we're looking down into the canal yet again, but the roof of the canal will be formed in part by your internal abdominal oblique, which is reflected here, and then your transversus abdominis that we see at this level. And then lastly, we'll have the floor to the inguinal canal. A good portion of the floor will be formed by the inguinal ligament. And as that inguinal ligament approaches its medial attachment to the pubic tubercle, there will be an expansion of the inguinal ligament that will run more posteriorly to attach to the pectineal line of the superior ramus of the pubic bone. This expansion of the inguinal ligament more medially forms what is known as the lacunar ligament, so it will contribute to the floor as well. Again, there's some additional geometry that we can learn about in the discipline of anatomy, and the inguinal region is no exception to that. Here we're looking at the inguinal triangle, also known as the triangle of Hasselbalch. This triangle is bounded inferiorly by the inguinal ligament, which is running right along here. So that would actually form the base of our triangle. Another portion or boundary to our triangle is the lateral margin of the rectus abdominis that we see along here. And then this boundary or border to the triangle is formed by the inferior epigastric vessels. So again, we have a nice geometric triangle formed by those three structures. Understanding the inguinal triangle is useful in one understanding the difference between a direct and an indirect inguinal hernia. Here we have a herniation of intestinal loops into the scrotum. This is more common in men, but we can have an inguinal hernia occurring in women. The difference between a direct and an indirect is the relationship that the intestinal loop will take to enter the scrotum. In the profile or image side here on our right, we have in reference, we have our inferior epigastric vessels, the artery as well as the vein. And here we can see a herniation of an intestinal loop into the scrotum, and it takes a direct route into the scrotum because it passes medial to your inferior epigastric vessels. The left side of the image shows an indirect hernia. Here the intestinal loop is passing lateral to those inferior epigastric vessels. Therefore, it will pass into the inguinal canal and will have to exit at the level of the superficial inguinal ring, which is at this general location. And then once it passes through the superficial inguinal ring, it can then herniate into the scrotum. That now brings us to the important take-home messages from this presentation. First, the muscles of the abdominal wall are innervated by anterior rami from levels T7 all the way down through L4. Collectively, attachments are to the thoracic cage, pelvis, and femur. Anterolateral muscles compress the abdominal viscera and function in lateral flexion and rotation. The most powerful muscles of the posterior abdominal wall, the psoas major and iliacus, flex the thigh. The inguinal canal is a potential point of weakness, allowing for direct or indirect herniation of intestinal contents. The inguinal triangle is bounded by the inguinal ligament, inferior epigastric vessels, and the lateral margin of the rectus abdominis. And lastly, direct hernias pass medial to the inferior epigastric vessels, whereas indirect hernias will pass lateral to that vasculature bundle. Thank you for joining me on this lecture on the muscles of the abdominal wall, as well as its vasculature and innervation.